think the environment has to be
What we're saying is have a heart.
We've got to be able to regenerate our
There'll
economy.
be people who are kind, people who are cruel, but that's life. You can be bigoted about bigots. I'm fine with that.
What do you think can be, ought to be changed, or what should be changed? What can we do?
Well, I think there's a tremendous silence in this country which needs to be addressed. There's no billboards, there's no radio, there's no television advertisements. There's too little being done.
But maybe there are not that many AIDS patients. And there are other diseases that have a lot more victims.
I'll tell you honestly, we have had ministerial discussions and where we were a lot more passionate and we banged tables. And the answer was this: you only have X amount of money. It will only go so far. What are your pressing needs? Is it the diabetics? Is it the people who are dying from heart attacks? Is it the people who are dying from cancers? What can we do about it? So we're talking about, hence the progress now is towards preventive medicine. It's going to be cheaper than having to do with the treatment of medications. Perhaps one way is, since generics can be quite readily available, is to make testing even, semi-compulsory in Singapore, and that everyone kind of goes through it like a rite of passage. The boys here will go through it as part of national service, and then when we leave national service, it's a rite of passage to get HIV test done too. I think that's good because it's a form of screening. We the boys, we're used to it. We're used to regimental things. My point is this: people come forward, do testing, voluntarily as often as possible, to the fact that it becomes normal for me to just go for testing.
But before testing can happen, then we need to work on stigma and discrimination, because that's one of the main barriers that's stopping people to take a test. And having laws that prevent people, the IDA is there, travel ban is there, and these are stopping people from taking a test. So we are one of the few countries in the world that still have a travel ban in place, which doesn't make sense, because if testing is not required at a employment level, then it doesn't make sense there. Then why have a travel ban?
I'm going to elaborate Avin's point on travels ban, which in essence is this: if I'm a foreigner working in Singapore and I turn out to be HIV positive, my passport number will be recorded for life. I will never be able to come into Singapore except to seek medical care, having informed the Ministry of Health prior. Okay? Now, it's discrimination, because there are many people who are HIV positive. They don't it themselves. They haven't declared it to the government of Singapore, and they come in and out. And there are many of them who are HIV positive, not on medications, come here and do things beyond tourism.
Oh, okay.
So the ban is a way of overcoming some of these measures, but the ports coming through Singapore are too porous.
Yeah.
Okay, it is redundant.
Yeah.
Okay. But coming back to Susan's point that that AIDS deserves a higher profile, maybe it's a question of government prioritization of what's more important in Singapore as far as disease is concerned, and cancer, heart disease and all that actually affect a lot more people and affect us economically a lot more than AIDS, which seems to be in a somewhat enviable position that it's in reasonable control with available generic drugs around.
But the point is that, we're talking about young people who are going to be experimenting sexually between the ages of 15 and above, And I think it's it's in the government's interest to do more in terms of prevention and preventative
But maybe not to the
education.
extent of having endorsement at the highest level.
Sure, okay, but I think certainly that more needs to be done.
Okay. Avin?
I think if you can remove some of the redundant legislation, then we can send a signal that now the government don't judge this. It's not. They're sending a right signal downwards, and there should be less judgment, discrimination for people living with HIV and the virus itself. Then you can help reduce stigma and discrimination, and therefore then more people can come and test. We can go to schools to do education, have proper anti-discrimination laws put in place to protect employees and employers as well. So that's travel ban has been discussed for many years now, 3 years, 4 years. Nothing. Yeah.
Can we not turn it around? I mean, economics is very important to us. Can we be the center for AIDS treatment for Asia? Is that a possibility?
Our numbers are not big enough.
No, for people to come here, like we are the center for medical treatment.
Yeah, sure.
Okay.
Yeah.
That would be a real turnaround.
There are improvement, but not fast enough for a lot of us.
So what do you want to see?
Let's just talk about improvement. The fact that we can sit down here and talk about HIV and even telecast social media, that's an improvement. And we see big campaigns coming out on TV talking about discriminations, be positive, that's improvement. And last year we are allowed to, for the first time on TV, we are allowed to use condom. We're not allowed to use condom on national TV and radio.
On TV advertising, you're allowed to. Nobody's going to stop you from using a condom.
Last year they said,
We're talking about advertising on
we have
television.
been, you're okay to do. I think Avin went up and say, safe sex, you can use condoms. So there are improvement in certain area, but not fast enough for a lot of us. The improvement is so slow. The sexual infection and advances of sexual encounter and everything is so fast. It's double the rate of your improvement. We need to move faster than that. And for government to even approve the FAQ, it's also an improvement. It's also an improvement.
It
is an improvement. So, but definitely not fast enough. A lot can be done. More can be done. But as you know, Singapore government takes baby step. They take baby step, and they have to take into consideration of so many parties involved, and so
That's not unreasonable.
it's not unreasonable. We still have to push. We're still pushing 377A, and it takes time. But one day we want to see that you don't criminalize that, and then
Okay, Joanne.
Believe more can be done, and we need to find innovative ways to do so. Corporates have the power to do a lot. For example, if a person is living HIV, then have policy in place so that the person can be economically active and contribute back to the economy. So, if corporates are looking for innovative way, they can always partner. As an individual, I hope that more people will step forward for voluntary testing, because when you test, then you can get access to early treatment and also have alternative ways to maintaining a healthy lifestyle.
Okay. And James.
Basically, what all I said, I mean, more can be done in terms of educating, the public, community, helping, getting the community involved in terms of allowing them to do testing at venues, sites.
I think listening to all of you, I think what's wonderful is that we have a lot of volunteer contributions here, which are very, very important to the treatment of AIDS and the control of AIDS. And these all come from the heart. And I think that if we didn't have people like that in Singapore, we would be at a greater loss. But I feel that the recurring concern is that education is so crucial, but education is not enough. It is not reaching out to enough people. It's not reaching out to certain segments of the population, like the Thai appreciators. And also, I think that in terms of providing the needed education and the sensibility of how people should regard AIDS and treat AIDS, the government will also have to reconcile competing interests. And while they can be clinical about this is what you should do, that if you're going to have sex, or if you're going to have gay sex or whatever, then this is what you should do to protect yourself, that cannot be taken in isolation. It has to be taken within the context of religious sensitivities among the Christians, among the Muslims, and you need to reconcile the two, otherwise there will not be total acceptance, and that's what we need. We also say that while education is so important, it is not enough, and perhaps there should be, as has been the case in some situations, a stronger hand of government. And here I think a stronger hand in government, although not very welcome in some instances in the past, here it would be very welcome. Number one, to have perhaps a greater degree or even mandatory testing for everybody, if not for everyone, maybe for those going into NS or going into where you can capture large numbers of people. And also I think that apart from compulsory testing, as far as workplace treatment is concerned, perhaps since no initiative, apart from some companies, have been taken to mandate how staff with AIDS should be treated, the government should come up with a set of mandatory rules, because Singaporeans are conditioned to live by rules that the companies can adopt to spoon feed them, and in this case I don't think there'll be many complaints. The final point I want to add is I'm going to leave it to Dr. Leong, and this is the approach that we should take in the treatment of AIDS, which he has mentioned before, but I think that I best leave it to him to do that, as far as early detection, early treatment, and things like that is concerned. How do we address the condition of AIDS in Singapore?
10 years ago, HIV was a disease for the dying. I've seen and cried with patients who died. But now, it's a disease for the living. Technology, medical advances have allowed us to detect HIV early, and with that, we can begin treatment. And when treatment starts, a new life begins. The only thing which I really want to do is to advise the listeners this: get tested, start living.
Thank you, and thank you all of you for taking part in this discussion. Good night.